Hi everyone, welcome to See the Invisible, Living with an Invisible or Rare Disease. My name is Rhonda Franny Jefferson, and thank you so much for taking some time out to listen today. If you're new to this podcast, welcome. To share a little bit about what I hope to do with this podcast is to spread some positivity, encouragement, support to all of those who have an invisible or rare illness. These also tend to be chronic illnesses, so we have to meet objectives and challenges every day. So, I just wanted to lend a voice to that as I've faced some negative experiences myself. I wanted to take some of the energy that I felt and turn it around from being a negative energy to positive. So I hope that everyone gets something out of the podcast. My topics can vary, and right now we're looking at, health apps, health tracking apps, monitoring, things like that. And so last week I kind of got into some background, and there were a couple of articles that I read this week that were kind of insightful and maybe not always in a good way. So, also, just before I ever start any podcast, I do like to say that I am not a medical, insurance, or legal expert. If you do have any questions regarding those specific areas, please make sure that you're reaching out to the appropriate field. Also, as this episode is really focusing on some technology, I am not a technology expert. But since these apps or wearable devices are actually being targeted for your average everyday person, I think it is important that they really be accessible as far as understanding the tech that goes along with them. So just to reiterate a little bit about where we left off last week is I'm concerned about the reliability of some of these apps or wearable devices. The FDA has not approved any of the apps that were reviewed for one study. There was a study that reviewed 107 health apps that mentioned hypertension or high blood pressure. And out of those 107, only 3% were developed by healthcare companies, and none were approved by the FDA. So, to me, going forward, it's the ability to have faith in these apps or wearable devices that they will be accurate, especially as right now there is no oversight. One article that I read last week, and all of the articles that I reference will be listed in the description. Even some articles that I may not have pulled direct examples from, I still think they might be interesting to read, so I'll also include them as well. So looking at technology right now, it's really a huge jump from even just 20 or 30 years ago. Growing up, I watched shows like Bionic Woman, $6 Million Man. And the one thing I thought of was Rockford Files. A few years ago, I just happened to come across it on TV. And for those unfamiliar with it, I believe it was set in the late 70s or early 80s. Rockford was a private investigator, and in his car he had, this old cell phone. So it was one that was actually connected to his car, and at the time that would have been state of the art, cutting edge, to have that in your car and in your possession. But still, if he was away from his car and he needed to make a phone call, he had to go to a phone booth. And I catch myself watching these older shows and saying, just use your cell phone or just look it up. And then I end up thinking, okay, well, that was 15 years ago. And, even though some of the technology is still the same as far as the type of technology, the advances as far as speed and accessibility, by making it less expensive, all of that has changed. So looking at 15 years ago and today, they're totally different expectations, I think, when we look at technology. And going back to where, say, my mother and father, when they were growing up, they probably would have never thought that, we would be sitting here with smartphones that could connect to the internet. But here we are, and it is an important part of everyday life, whether you have some type of illness or not. It's something that people use to communicate and gather information. And as having a rare illness is really a big part of my life, it does come into a lot of aspects. I want to take the time that I have now, and I'm trying to learn more about what's out there as far as choices to make my life easier, to make the quality of my life better, because I do have 2 children. I want to make sure that I'm providing for them and that I'm active and healthy enough to interact, to enjoy what they're doing, and not let this time pass by without being an active part of their lives. So looking at technology, I think that's something that, for me, at least in my situation, it's really something that I have to look at so that I can try to keep up with my children. There's also information out there for one of my children who is on the autism spectrum. Again, 20, 30 years ago, this information was not known. He probably would not have a diagnosis. And even though it took a very long time for me to get his diagnosis because there were so many switches with his pediatrician, now that I do, I can go in and look at resources, look at information, and try to find ways to help him as well. So, I'm looking at it for my family. It's my responsibility to go in and, try to find out as much as I can about the apps. Now, kind of piggybacking off that, I also realize that not everybody either has physical access to a device or app, or even the internet on a regular basis in order to make sure that these work properly. I know what it's like for the internet to go down for just a little while. In the past month, it's gone down 4 times, 3 times for an extended period of time, and last night it started going out again. Thankfully, it's still available right now, but it keeps going back and forth. I recognize, though, that not everybody has full and complete access to the internet. So, just having a certain amount of data on your cell phone does not allow you to, possibly go in and research everything that you need to, or to keep a wearable device on you that might transmit information. I know I have a couple pieces of equipment that, constantly check things, and they're motion censored, and just the increase in the data that I use from those is, huge. I've used so much data this month, just with that one device, that, if people were wearing these types of mobile devices that are there to prevent flare-ups or help someone manage their illness, what would we need to do in order to make sure that everybody had the access to the quality health care that they need and that they deserve? So that is one of the biggest hurdles. It's just accessibility, and it goes from whether it's socioeconomic or the ability to actually use the items. Right now, for my father, he's 86, I believe. Yes, 86. And he's never used a computer. He's not used a smartphone. He does have a flip phone to help him, just have it with him in case he breaks down or something, because he's still driving. But, he doesn't use a smartphone. So, if he needed to go buy these apps for something, the understanding would not necessarily be there. It's not necessarily about him not wanting to learn. It's just the fact that all this technology is so new. And since, he was retired before a lot of these advances took place, then, he never really got a chance to use them. And now it's, 20 years after his retirement, is he really going to be So we need to make sure that we bridge that gap in making sure that all those who need the health care are actually able to attain it. So another thing that I heard is that some doctors are starting to use tech to actually track their patients' compliance. So, compliance, that can bring up a load of so much emotion and feeling. Because once again, I came into some articles that did discuss compliance of taking medication, staying within your treatment plan, and one, it made it sound like compliance was everybody's choice, which I know by experience it is not. There are factors into that, such as is it an illness that is life-threatening immediately? What's the the patient? What is their willingness? But then something it didn't really mention, I believe, is the accessibility again of having the ability to even pay for your medication. It was just basically this tech is here to help you take care of yourself, and it's the wording on it was really negative to me. And starting to read it, I almost stopped because it was a blame. It was saying that we needed our those with an illness needed their hands held. So that was really kind of surprising to think, why do I need my hand held? If something's there that can help me manage my life more efficiently, I'm all for it. But I'm not for using wording and phrases that can help denigrate those with the illness. Some people may start to read something and see some wording like that and just stop reading, so they'll be missing the information that they really need. So the article that I'm referring to was from the Wall Street Journal. And to quote the first paragraph, technology is offering a new fix for one of the most confounding healthcare issues, self-management that many patients have been unable to handle. So that right there makes it sound like, as patients with an illness, almost like we're wilting flowers, that we're just not able to handle it, or we can't find solutions to try to handle it. It goes on to say they often become overwhelmed by the demands of their daily regimens, slip back into poor health habits, fail to take their medications correctly, and end up in an emergency room. So again, to me, that is, saying it's all actions by the patient, when in actuality, there are other factors that may come into that. What about, again, going back to finances, there are a couple of medications that I can't take because either my insurance doesn't cover it, or because of the deductible and out of pocket, it would be about $1,500 a year. And it's not something that I particularly need to, it's not life-saving, but at the same time, it would help the quality of my life. But at $1,500, with my insurance not covering it, there's no way that I can afford that. So looking at a line or a paragraph where at least the words to me, like overwhelmed, that we're unable to handle, that I think is a misunderstanding of those who are actually writing this article. I don't know the journalist, of course, but at the same time, it makes me wonder if she's actually spent time with someone with a long-term chronic illness that is managing. I believe part of it is she may not even understand that there's dozens of people that she might come in contact with in a week that have an invisible or rare illness, and she just doesn't realize it because we are managing it. We are taking care of ourselves to the best of our abilities, But when something like insurance and accessibility aren't there, then there's not much that we can do other than try to take action, whether it's by writing a local legislature, contacting a congressman, expressing your concerns to your doctor, or just replying or referring to articles such as this that really portray a misunderstanding of what it's like to live with an invisible illness or a rare chronic illness. It's not that I think any of us are saying, I don't want to comply with my treatment plan. It's sometimes an ability to do so. There's also side effects of certain medications that may make it difficult to actually stay compliant. I have a few different medications that have horrendous side effects that make it very difficult at times. One of the medications, I actually have to take another medication to counteract the side effects of the medication that I'm taking to counteract the side effects of the first medication. So I actually say that my medication has grandchildren because there is a very important one that I need to take, but it causes an issue with a different illness that I have. So I take that medication, and with that medication, it causes a different side effect that I need to take another medication for, which I tried to stay away from. I wanted to skip those last two, just take the original medication because I didn't want to be reliant on that. But after about a week, and my doctor had said, if you change your mind, call, I couldn't take it anymore because I wasn't hardly able to walk. So I had to break down and say, I know I need it, and do it. But depending on your job, you may or may not be able to really function with some of the medication if the side effects, say, make you feel ill or sick to your stomach. Some medications, if you're on steroids, they have issues, at least for me, of causing hot flashes and making you uncomfortable. That can impact your work. So it's so much more than just saying a patient is not compliant. It is an ability to take the medication, whether or not that patient can effectively do so without negatively impacting other parts of their lives, whether it's activities or financial, to make sure that they're able to provide for their family. So most of the health apps that I found to help manage or balance out, managing your health, especially if you do have an illness where you need to take multiple medications or have something monitored, such as your blood sugar if you have diabetes. A lot of those apps require interaction with both technology and a human being. So I do find that very assuring. That is not just a computer relying on an algorithm that someone has input. What happens if there's something wrong with the algorithm? Things aren't perfect. Something might have been entered incorrectly. So, that is kind of a doctor and patient skepticism when you take, the human being out of the mixture. So there are some apps too that monitor things, take a look at some questionable items if they come through on the report, and that's turned over to a nurse. So that's very positive as far as keeping, the health care personnel interacting with you so that they can get to know you and know what's right for you. Now, I do want to go over just a few, I'd say less than positive obstacles that these apps or monitoring apps may come across. Now, I've already mentioned about the accessibility, whether it be because of funds, and also whether it be because it's not something that the person feels comfortable with. I mentioned the skepticism that sometimes, going from one system to another can be very, very difficult. There's, also the fact that most humans do not like change. So to go from always interacting with a nurse or a doctor face to face to be putting in your information to an app every day that's sent to them, and then possibly using telemedicine to communicate, that may make both the doctor and patient, or even just one of them, feel a little less at ease. So just with time, hopefully it'll come to a point where we're much more comfortable. I admit that I was not comfortable with telemedicine, but at the beginning of COVID-19, I had to go with that because, having a compromised immune system, my doctor had said, don't take a chance of going out, even if you feel sick. So that's what I did. Another drawback or obstacle could be just the integration and the software of the apps or technology. I don't know if you've ever experienced it, but your phone updates and then all of a sudden apps that were working the day before aren't working. You get a new phone, computer, tablet, and again, what you've used before on your previous phone or tablet isn't working anymore. So there needs to be software that integrates all aspects of the treatment plan, whether it's a health app that's specific to that doctor or whether it's a more general one, as well as making sure it stays up to date with any new types of systems or any new phones that come out. Further, if it goes beyond just a basic health app that's generalized where a lot of patients can use it whether or not it's with the same healthcare provider, some of the larger healthcare systems are actually developing their own software. So what happens then if a person is traveling and something comes up hundreds of miles away? We need to make sure that there's an integration where the software can work anywhere and the patient will still be able to bring up their information if they need treatment in a different location. So I know there's a lot going on with that. People will really need to take initiative on that if they're developing these apps or software so that everybody is fully covered, even if you're out of state or anything like that. So again, the last thing is how reliable are some of these apps? Right now, as far as my comfort level, I feel very comfortable if these were to be apps that I could go in and say, okay, this is my temperature for the day, or, I did have the step counter on my phone and this is how many steps I took, and, things like that. But, my smartphone that is supposed to be able to unlock with my fingerprint or my face, I've never been able to open it with my fingerprint except for one time when I first set it up. And on multiple occasions, it tells me that it does not recognize my face, even though, there's no rhyme or reason why it should not recognize my face. But if this happens on such a regular basis on a relatively new phone, I think it's only 5 months old, what must it be like for, phones or tablets that are older that or supposedly having this biometric information, but we can see it's not working. So I would feel more skeptical, and this is just me, these are my experiences, of some type of monitor that you have to wear, because I would always be in the back of my mind, is this really working properly, because of other experiences that I've had. And we also do need to remember that most of the apps were developed with, say, joggers, weightlifters, things like that in mind, not necessarily for someone who is really trying to monitor and take care of an illness. Now, looking at monitoring software, though, there are positives. And I did the negatives first because I kind of wanted to end on a more positive or bright note on this, so that we're hopefully getting something out of this podcast where it looks like, we're going in the right direction, and hopefully, not only for better healthcare, but also for better cost effectiveness. So going back to where apps are there to work with the patient and the healthcare provider, I feel like those are more readily accepted by most people. Connecting them to actually a real life person. The healthcare provider gets information and then feels like, okay, it's something I need to reach out to the patient and figure out what's going on. Something that also seemed, I guess, futuristic is the only way to describe it, but for a blood pressure medication, there was actually a tiny sensor. They described it as small as a grain of sand that could fit within the medication, and it would help tell if you were being compliant with that blood pressure medication. So it's kind of amazing and, to me, worrisome at the same time, because it takes away from your autonomy. But at the same time, if I guess you're not taking your medication as directed, it could lead the physician to reach out and try to find why. And if it is something as far as affordability, maybe they have some suggestions that might be able to help. One of the biggest advantages, I would say, from the information that I read about, is it does give some of the power back to the patient. They're able to reach out on a more consistent basis, and going back to accessibility as far as being able to afford either the medication or the software or app that's needed, that I think leads to a more open and honest conversation with your healthcare provider. Also, when you accomplish something through that app, whether say for the sake of your illness, it would be best to lose some weight. Seeing it on an app, it gives you that power and that feeling of control over something in your life, especially when we don't have any control over what's actually happening with the illness. So one of the biggest aspects, I really think, is the emotional positivity, the emotional, I guess, push that it brings to you, and shows you a sense of accomplishment. There were some hospitals that have run tests using some type of healthcare app. Now, these have primarily within the U.S. been on the West Coast, Utah, California, and that's actually in California where they did that sensor that was about the size of a grain of sand. So, like I said, kind of amazing, but at the same time, a little worrisome. But, right now, it's more on the West Coast. Looking at it, if it was accessible across the U.S., if it was accessible even going out further, it could help with decreasing the costs of overall health care. I know one of the biggest concerns with the non-compliance is, yes, the fact that some people may end up in a flare-up or end up in the hospital, and that, of course, costs insurance companies much more than a doctor visit to try to come up with a solution, whether or not you go into a flare, do you need to change your medication or amount. It's a more proactive instead of reactive approach. So, that's actually a really good thing that these apps are doing. But right now, there were 5 apps that I will leave the link to. Most of them required input, like more input from the individual than actually, monitoring. So, again, that gives the patient the ability to take steps themselves and see what they've accomplished. I know in some ways that's what the article that I did not like was saying, but I think it was the approach that was taken. It almost seemed like there was a blame going to the patients when in actuality there are other key components to life that might be keeping people away from being compliant. I know also, going back to another situation I had, a medicine that would make me rather drowsy, I couldn't drive with that, so that could also take away from what I was able to do. So there's just more than just a cut and dried answer for everybody. So also looking at the consumer, aka the patient, sometimes I think it feels less judgmental in some ways if you're communicating through a phone and not actually face to face. I admit I've done some things I shouldn't have, such as I felt an infection going on, and don't ever do this. I took some medication that I had left over. My doctor had given me antibiotic, and I needed this for a long, long period of time. But we got to a point where I didn't need it anymore, so she had said, you can stop taking it, but I still had some left. And when I did end up needing to go to the ER, because it did not stop the infection, I was talking to the doctor, and it was really hard to admit to him face to face that, okay, I did this. But I did. And I just wonder myself if it would have been easier if I told him this, over the phone. Also looking at the generations that are coming up, most people feel more comfortable, chatting on their phones, looking at a screen as compared to actually going into a doctor's office, because you have to take off work or take off from classes and go into the doctor. Having the ability to just be able to, go onto your phone and not really have to take out an extra hour or two of your day. It's all there, with the telehealth options. So, a lot of those studies on the West Coast, it did, actually help people lose weight and treat their illness. Again, I know that weight is probably a big one because it does or can affect your blood sugar, blood pressure, heart disease. But it's almost like having a coach to some extent. When I was reading the article, it almost made me think of the new Weight Watchers, which I admit I've started. Haven't done as much with it, but I'm trying. But there are coaches and there's support in there, and I think that's what everybody needs. And beyond, say, a healthcare app, please make sure, if you feel comfortable sharing with others, that most illnesses do have a Facebook page. Now, if it doesn't, say if it's a rare illness, why not, open it yourself? That way, even though it's rare, you have created a page for people to come and communicate and talk about an illness that very few people can really talk about. So I know sometimes even if I'm just scared or anxious, I go ahead and go onto my support group online and you get support from them. I can also lend support if I've been through a similar situation. So, beyond just a healthcare app, you can also look at some social media as being positive. Yes, I've done another episode where it was not quite so positive, but it can be. So it's just kind of whose hands is it in? Is it in someone who's really trying to make a change and be positive? If so, it's doing its job. So some of the apps that were the most top rated for trying to manage your chronic illness, there was one called My ID, and it helps you keep track of all of your information. Before last week, we actually talked about the electronic health report or record, and that was all of your information being kept electronically. But sometimes there are things that you need to keep personally on your own. Now, the My ID does have a lot of the basics, such as any medical conditions, your address, any medications you're on. But really importantly, it also lists allergies. So, that will give information that you need. There's also MediSafe, and that will help you keep track of when you've taken your pills or medication. I've accidentally taken the wrong medication at night. It's really something that should have been taken in the day, so I was up half the night. So having something where I have to actively go in may help me keep better track of it. And I know a lot of the apps will also send reminders, so if you've forgotten, you'll get the reminder. There's another one called Pain Scale, and being someone who has to live with fibromyalgia, and it's another disease called Still's disease, but part of it is, contains the symptoms of rheumatoid arthritis. On Pain Scale, you can actually like draw parts of your body, so they'll have a figure, and you can maybe circle your shoulder, elbow, and it allows you to track where you're feeling the pain, so that when you go to the doctor, you're not having to sit there and say, okay, it was about 3 weeks ago, and it's all there, exactly where you were hurting 3 weeks ago, what day it was, and as well as sharing that, it also can keep track of other things, such as if you're having symptoms where you think you might be having a flare-up. So that's really beneficial. Now, there's one that I really want to get into looking at. It's called Fooducate. So it's Fooducate. So it's educating you about food. I know with having an autoinflammatory illness, there are foods that both increase the inflammation and those that take it away. So having an app that's in your hand where the information is more accessible, rather than just doing a Google search and trying to find it there, you have recipes right there that can help you. You have a community or forums that you can go in for information. So that is an app that I'm definitely going to be trying. And then the last one that I saw highlighted was one called TEMed or Plus EMed. Now, this one, I feel it's almost like a diagnostic tool in a way, but it gets you to the right doctor. It has a listing of doctors from more than 50 different specialties. And what you can do is go in and, put in some of your symptoms, and the app will try to figure out who is the best doctor for you. To share some of my experiences, I was seeing a whole slew of doctors, and I was not really getting the help that I needed. They weren't able to determine what I had. And they were going to send me to an endocrinologist, and based on everything I knew, I'm like, that's not going to really be beneficial. But at that point, that's really like one of the only specialists I hadn't seen yet. Now, things came up. My sister actually passed away on the day that I had the appointment with them. So I did cancel. And it was the next year that I was diagnosed. So, yeah, the endocrinologist had nothing, really nothing to do with the illness that I had. But, hopefully with this app, it can help direct you to the right doctor so that you're not going to 5 different doctors and they keep referring you back and back and back to someone else. So, these are some of the issues, whether they're positive or negative, that I found reviewing apps. Where I do want to end with is, I know there are some devices out there that are continually monitoring, such as the blood sugar. There's a few different kind that actually do that, where you have the sensor in, say, your arm, and it works with an app. I've read some things saying sometimes the sensor is not on as tight. The adherence or adhesion to the skin may not be what it needs to be. So going back to where, I'm looking at, okay, is this a first gen item? Is there a way that all of these issues will be fixed for, the second and third generation? Where I'm looking at, though, are the frequently asked questions. I would say, just as a suggestion from what I've observed, is if you're unsure of whether or not you want to use an app, you may need to download it before you actually see the FAQs. If they do have a website that has the FAQs, I'd probably go there first. But that way you can see if there's any issues. if there are issues being asked continuously about whether or not a sensor is working properly, about the maintenance that you need to do, anything related to that topic, you can see just how much patient input it needs, how reliable it is, because if you see a lot of things about error messages or information not being able to be read, then you may realize, okay, this is not the app that I'm looking for. So I hope some of this information has been informative or maybe even a little eye-opening. I do hope that very soon that some of these medical advances can make sure that everybody has quality care. We're blessed, in my opinion, to live in the United States, and even though the insurance and healthcare cost can be rather high, I'm sorry, I just had a technical issue. So I was just ending, with looking at the apps and, other type of healthcare. I really hope we can get to a place where everybody has access. That I realize if I had not been born where I was, there's a possibility that I might be hours away from a doctor in healthcare. So, even though a lot of times the bills are extremely high, I wonder if I did not live as close to medical care, if we did not have the ability to take or run tests and have the results come back so quickly, if I would have gotten my diagnosis. It may have taken a while to get it, but without having some of that capability, it may have even taken me longer. So I look forward to the time where, all the testing possibly doesn't need to be done because things are integrated into a system where it can help narrow things down. I know that we're not in a perfect world, but that is something to hope for. I would say for my kids or grandkids generation, but as quickly as things are moving along, who knows, I could even see it in my lifetime, which I hope to do. I want everybody to have access to basic rights, and I do consider healthcare one of those, because someone should not need to choose between a cancer medication or they need medication for their liver, kidneys, vital organs. They shouldn't have to make a choice between what they pay for that month. And a big one that I think of is the EpiPens and how quickly they went up. And I had EpiPens for a while, but I can't afford them anymore. So even though there's not an app for an EpiPen, there's no way to do that. But if the overall health costs go down, hopefully that will be reflected in all aspects. But also having some electronic records, having a record on your own phone may help doctors or those trying to assist you understand what's going on, because your health information will be there. And allowing the sharing throughout different systems will do that as well, and therefore create a more expedited healthcare process for everyone. So thank you so much for listening. I do want to also mention I am starting another endeavor as well. With my illness, my doctor has said, I can't really go back to work. So I've always been someone who needed to have and wanted to have an active mind. So not being able to be active has kind of, it's been hard for me. But I did want to start a podcast about true crime. I am kind of a true crime nerd, but to me, true crime can sometimes reveal motivations, factors that can lead someone to act the way they do. And, if you've listened to previous podcasts, you may have heard me say things such as, everybody's situation is different. That those situations mold who a person becomes. So looking at the full background of both a criminal and a victim, looking at unsolved cases and trying to see, if there's anything there that might point to a certain person. It's also showing the advancements in science and technology as well, which sometimes have a benefit for those who are ill with something else. So I hope to have it out on Wednesday. So this coming Wednesday, it's called Danger in Delaware. So if you can't tell by that title, it's about the first state where our president is from. But Delaware is my home state. I do have, I'd say, a unique perspective. I've lived in what's called lower, slower Delaware, where things are more rural, laid back. And then I've also lived what's called above the canal, which is a canal that kind of splits the upper county from the bottom two. Yes, there's only 3 counties. So I've lived up there. And I've also lived in a suburb of New York. So I've kind of seen a lot of different communities and cultures. And I think that will help lead to a new perspective on, some of the crimes that have taken place in this little teeny state. That probably up until Biden running for president, so even when he was vice president, not too many people probably ever thought about Delaware. And I still hear Bill and Ted when they're like, we're in Delaware. So, I really look forward to that endeavor. I probably will be doing it every 2 weeks instead of every week, just because, sometimes recording takes a little bit out of me. Like I've been going back and forth, stopping recording a couple of times, taking some breaks. So I don't think I could do the crime one every week. But this week I am starting off with a case that was on Forensic Files as well as Unsolved Mysteries, one of the best shows ever. And, it's always intrigued me. So, I wanted to go ahead and start with that. I won't tell you what it is in case you want to tune in. You can be surprised by the outcome. But again, it's called Danger in Delaware. And I hope if you get a chance that you can go over and listen. Now, if it's not out on Wednesday, I'll try to have it out on Thursday. But my family did experience a death in the family this week. So I am trying to work on arrangements as well. Working on this throughout the afternoon kind of took my mind off that. But I will try to get that out by Wednesday as I have most of the research done. It's just a matter of recording. All right. So I want to thank everyone again. I hope everybody has a great week. And I look forward to speaking with you on next Monday, or even better, if you wanted to check out Danger in Delaware sometime this week. Thank you all. Bye.